Good afternoon, everyone. I'm Zhili from Hawaii Hospital. Today, I will share with you the presentation focusing on the high-risk screening of cardiovascular disease and also an overview of hypertension. So you can see that blood pressure is a key component of this initial screening. So what is hypertension? The prevalence of hypertension is still increasing in China and is characterized by a high prevalence in the northern part of China, while low in the southern regions. Here in Beijing, the prevalence is about 36%. In addition, the awareness and treatment control rates are still relatively low, with 51.6% were aware of their condition and only 46% were taking prescribed medications, and only 17% have controlled hypertension. So this diagram shows that in the past 3 decades, that is between 1991 to 2015, the rate of awareness and treatment, also control rates, are constantly increasing in China. So in this process, we have established and accumulated a handful techniques and experiences to how to prevent and manage hypertension. So we want to share this with our friends from Southeast Asian countries. In Southeast Asia, the awareness of hypertension is still less than 50%. And of those aware, only about half are on treatment. So the control rate blood pressure below 140 over 90 millimeter of mercury remains dismally low. This diagram shows that the prevalence between the relationship between the prevalence of hypertension and risk factors. These factors including men, older age, high sodium, low potassium diet, overweight and obesity, and also family history of hypertension, lower educational level, and smokers, alcoholic drinkers are significantly associated with an increased risk of hypertension. So, what is the definition of hypertension? A clinic systolic blood pressure not less than 140 millimeter of mercury, and or a diastolic blood pressure not less than 90 without the use of antihypertensive medications are defined as having hypertension. Please note that the hypertension is divided into grade 1, 2, and 3 based on the blood levels. So we can see that if a person have a blood pressure not less than 140 over 90 millimeter of mercury, they are defined as having hypertension. If the blood pressure is the systolic blood pressure is less than is between 120 and 139, and all diastolic blood pressure between 80 and 89 millimeter of mercury, they are defined as having high normal blood pressure. If a person's blood pressure is below 120 over 80, they are defined as normal blood pressure. And depending on their blood pressure, they are graded as grade 1 to 3 hypertension. For instance, if a person has a blood pressure of 170 over 100 millimeter of mercury, they are defined as grade 2 hypertension. Please note that if there is a disparity in the category between the systolic and diastolic pressure, the higher value determines the stage. So, if a person is here to diagnose whether he or she has hypertension, how do we properly or accurately measure their blood pressure? We should prepare the patient in a rather quiet room with comfortable temperature. The patient should have no smoking, caffeine, food, or exercise for 30 minutes before measurement. The patient should remain seated and relaxed for 3 to 5 minutes before the measurement, and no talking should be made between the patient or the staff between or during the measurement. The patient should sit with his or her back supported by a chair as shown in this figure. His or her legs should be uncrossed and his or her feet flat on the floor. The arm should be bare, resting on the table with mid-arm at heart level. If a person is held for office blood pressure measurement, he or she should take at least 3 readings between, with 1 minute interval between the readings. We should use the average of the last 2 readings. But if the patient have normal blood pressure in the first 2 measurements, then the third one is unnecessary. So, in addition to office blood pressure, the out-of-office blood pressure also plays an important role in the hypertension management. We can see this on a study from the Japanese team done between the 2009 and 2010. If the patient have clinic systolic blood pressure below 130, the morning home systolic blood pressure determines the cardiovascular risk factors, cardiovascular risk. If a person has a morning home systolic blood pressure over 145, even all of them have a clinic systolic blood pressure below 130, the person with a higher morning home systolic temperature will have higher cardiovascular risk. So the guideline also recommend that the out-of-office blood pressure are important supplement to confirm the diagnosis of hypertension. So, besides the office blood pressure, out-of-office blood pressure measurements, including the ambulatory blood pressure monitoring and also home blood pressure monitoring, are important supplement to confirm the diagnosis of hypertension. For ABPM, ambulatory blood pressure monitoring, we will have this small device arm to measure our blood pressure at a 20 to 30 minutes interval. So we will have multiple blood pressure measurements. If the person's 24-hour average of blood pressure is over 130 over 80 millimeter of mercury, or his or her daytime average over 135 over 85, nighttime average over 120 over 90 millimeter of mercury, then the person is defined as having hypertension. Or if the home blood pressure monitoring, that is blood pressure measurement made by the individual, by the person himself or herself, or by a relative at home, is above 135 over 85 millimeter of mercury, then the person can also be diagnosed with hypertension. If the hypertension diagnosis is entirely based on the office blood pressure, then at least 2 to 3 visits at a 1 to 4 weeks interval is vital. If a diagnosis, in some occasions, the diagnosis can be made on single office visits. It's rare, but it can happen, including if the office blood pressure is very high, that means it's not below 180 over 110. Or there are evidence of target organ damage or evidence of cardiovascular disease. Otherwise, we should confirm the hypertension diagnosis with HBPM or ABPM. If these 2 procedures are available, then the individual should take more office blood pressure measurements. There are 2 special types of hypertension. The white coat hypertension, that means the individual will have high office blood pressure, that is not below 140 over 90 millimeter of mercury, but have normal blood pressure measured at home, then this time we should perform HBPM, that is home blood pressure monitoring, and also ambulatory blood pressure monitoring to confirm whether the person have white coat hypertension. If the ABPM or HBPM are normal, then the person should be diagnosed with white coat hypertension. That means the person should have lifestyle modification and annual ABPM or HBPM to detect the progression, but the medication is not necessary. Also, another special type of hypertension is masked hypertension. That means the person will have normal office blood pressure, but high blood pressure measured at home. Then also ABPM and HBPM are crucial to diagnose whether the person have masked hypertension. If these two tests are normal, then the person should be diagnosed with the elevated blood pressure. If the two tests are not normal, that means have elevated high blood pressure, then the person should be diagnosed with masked hypertension. Then, besides the lifestyle modification, drug therapy may be necessary. So after we have diagnosed the individual patient with hypertension, how should we evaluate his status? The risk of cardiovascular disease should be stratified based on the blood levels of the hypertensive patient, and also whether he has other risk factors, the target organ damage, whether he or she has chronic kidney disease or diabetes. From this table, we can see that if the person have more risk factors or have target organ damage or CKD or diabetes, or the person have higher levels of blood pressure, they are at higher risk of cardiovascular disease. For instance, if a person have a blood pressure between 140 to 159 over 90 to 99, and if a person have target organ damage or 3 or 4 other risk factors, he or she should be defined as having high risk of cardiovascular disease. These are the risk factors for the cardiovascular disease stratification, including age, that is men over the age of 55 and women over the age of 65, or whether the person have smoking or passive smoking. And also the blood glucose and lipid levels should be measured, and also whether the patient have a family history of premature cardiovascular disease, that is his or her relative has a CVD history before the age of 50, and also the abdominal obesity, that is waist circumference over 90 centimeters in men and over 85 centimeters in women, or obesity. Also, target organ damage, including that of whether you have left ventricular hypertrophy, which can be determined by ECG and also ultrasound, and also whether you have peripheral artery disease, including the carotid intima thickness over 0.9 millimeter or carotid plaque, and also the kidney function tested by EGFR and proteinuria. Patients with hypertension are at higher risk of comorbidities, including cerebral vascular disease, including ischemic and hemorrhagic stroke, and also transient ischemic attack, and also cardiac diseases, including myocardial infarction, heart failure, and atrial fibrillation, and also the renal disease, advanced retinopathies, and also peripheral artery disease. So in If a person is diagnosed with hypertension and his risk factors stratified, how should we treat the patient? The main purpose of treatment of hypertension is to reduce the total risk of cardiovascular and renal morbidity and mortality. The main benefits of this treatment are due to the blood pressure lowering per se. The medication should be administered on the basis of lifestyle modification according to the risk stratification of individual patient. And the medication treatment should be based on his or her risk factors, organ damage, and also the morbidities. If a person can tolerate the treatment, then intensive blood pressure lowering treatment should be recommended. Lifestyle modification is the basis of hypertension management, including the reduction on sodium intake, that is below 6 grams of sodium salt per day, and also balanced diet is recommended. The patient should control his weight and stop smoking, limit alcohol intake, and do more exercises, and also manage mental stress. There are 5 classes of hypertensive anti-hypertensive drugs, including calcium channel blocker, ACEI, ARB, diuretic, beta blocker. All these 5 classes are commonly used and are suitable for the initiation of anti-hypertensive therapy. The choice of the drug should be based on the individual conditions, and the long-acting agents are preferred to control the 24-hour blood pressure. If a person are at low risk or have relatively low levels of blood pressure, that is below 160 over 100 millimeter of mercury, then monotherapy is recommended. But also if he or she can choose combination therapy, but at lower dose combination. If a person have high risk or the blood pressure is above 160 over 100 millimeter of mercury, then combination therapy is recommended. The blood pressure target is mainly dependent on patient's tolerance and capacity of the treatment. The blood pressure target in general population is below 140 over 90 millimeter mercury. If the person can tolerate this blood level, then the blood target should be can be further controlled to below 130 over 80 millimeter mercury. In special populations, the blood pressure treatment targets can vary. For instance, in patients with diabetes, the blood pressure level should be controlled below 130 over 80 millimeter of mercury. But in elderly or coronary heart disease patients, this level should be controlled to below 140 over 90. After the initial treatment therapy were given, the patient should also be followed up in the long run. This is depending on whether the patient have controlled hypertension. They will be classified to level 1 or level 2 management group. If a person have controlled hypertension, then he or she could be followed up once every 3 months, and to keep up with the drug and the therapy and the lifestyle maintenance. If a person have uncontrolled hypertension, he or she should visit the office once every 2 to 4 weeks to have his or her drug therapy adjusted and to strengthen the lifestyle interventions. So, in summary, the hypertension is defined as a systolic pressure at least 140 millimeter of mercury or diastolic pressure at least 90. The diagnosis of hypertension requires integration of home or ambulatory blood pressure monitoring in addition to the office blood pressure measurements. The proper technique and interpretation of the blood pressure is essential in the diagnosis and management of hypertension. An evaluation should be performed to determine the extent of target organ damage, the presence of established cardiovascular kidney disease and other cardiovascular risk factors. Lifestyle modification is vital and it's the basis of hypertension management and should be prescribed to all patients. Blood pressure target in general population is below 140 over 90 millimeter of mercury, but it should be mainly dependent on patient's tolerance and the complexity of the treatment. So that's all I'm gonna share today with you. Thank you.